Hey, this is Dr. Gerhauser. Today I'd like to talk about one of the most common symptoms that I find in my patients. It's a condition called Gerd. That's Gastro Esophageal Reflux Disease. This is when the acids that are usually contained in the stomach back up into the esophagus. The esophagus cells aren't protected from the acid like the stomach cells are. So this can cause a burning pain that's in the chest or the upper abdominal area. The reflux of acid is thought to be caused by an impairment in the lower esophageal sphincter. Now this is a muscular band that closes the bottom of the esophagus, so the stomach contents are contained down in the stomach and don't come up. Your doctor will look for alarm features if you go to him complaining of GERD symptoms. And this may hint to an underlying issue that could be causing the symptoms. This includes persistent vomiting, difficulty swallowing, throwing up or coughing up blood, anemia, a 5% or greater weight loss when you're not trying to lose weight. If a patient has symptoms and is older than 55 years, generally they're examined with an endoscopic test, which is where you take a tube and look down into the esophagus. And this rules out cancer or other significant diseases. If a patient's under the age of 55, the individual is examined usually for H. pylori. That's a bacterium that's associated with ulcers and gastritis. If H. pylori is found, it is treated with antibiotics and acid-blocking drugs. Now, if it's not found, usually the symptoms are treated with a proton pump inhibitor, and this is used as a trial. The treatment lasts for about 8 weeks. Now, endoscopy is recommended if this doesn't relieve the symptoms. Now, if there are symptoms of GERD and there's no alarm features, as I mentioned above, then a proton pump inhibitor drug is usually used. Now, there are several studies that show that taking proton pump inhibiting drugs raises the risk of hip fractures, infections like pneumonia, and it can cause dangerously low magnesium levels. Now, when you block stomach acid production, something that's absolutely essential for the digestive system to work as it was designed, then health problems are likely to occur. Now, does your doctor tell you this before prescribing the pill? I hope so. In my practice, I try to look at a variety of factors that may contribute to GERD symptoms. Weight loss, which will increase the space available in the abdomen, will help. Also, avoiding overeating. Now, allowing 3 hours between your dinner and bedtime also can reduce symptoms. Light exercise after dinner and avoiding trigger foods such as fried foods, citrus fruits, tomatoes, high-fat foods, processed oils, coffee, alcohol, and caffeinated beverages. A natural treatment that reduces inflammation and aids in the healing of the delicate mucosa that lines the esophagus includes DGL, or deglycerized licorice. Chewing gum or sucking on hard candies can increase gastric pressure by swallowing air, and that aggravates the symptoms. Food allergies may be another cause of GERD that's usually overlooked, and this can be treated with an elimination diet. Overconsumption of simple sugars and carbohydrates also aggravates symptoms. Now, I recommend using a natural, nutrient-dense, whole foods diet as the main treatment. Fermented and raw foods gives you living enzymes that aid digestion, as well as giving you good organisms that are needed for the proper microbial balance. Magnesium is critical for the normal functioning of all the sphincters in the body, like this lower esophageal sphincter. The short-sighted treatment of symptoms with an antacid drug will lower your magnesium absorption and make it so that you need to stay on the drugs forever, as your magnesium levels will continue to decline. Now, make sure your diet is low in the factory-made fats. That's all hydrogenated oils and the highly processed vegetable oils. Drink plenty of pure water. Now, it's important to replace salts when you're drinking a lot of water. I recommend Himalayan salt or natural sea salt. For more natural health information, be sure to subscribe to our channel and tell your friends. This is Dr. G. Thanks so much for watching.